Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24-Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I have the opportunity to sit down with Michael Costa, who serves as the executive director for C4A, which is a little bit of a tongue twister, and I'll try my best here, but it stands for California's Association of Area Agencies on Aging. In today's episode, Michael talks about his journey starting as a young child, where he learned a little bit about policy from his father, who served in the shipping industry up in the Seattle area. And ultimately, Michael gained a career where he learned about policy and healthcare. And not too long ago, was connected to C4A, where he's been serving for many years. In California, I should say, the Area Agencies on Aging serve all 58 counties and got started back in 1965. Michael will walk us through that journey, which touches on the Older Americans Act and about the work being done in California, where in 2030, 1 out of every 4 Californians will be 60 years old and older. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Good morning, Michael. Thanks so much for joining the show today.
Well, thank you, Gavin. It's a pleasure to be here.
Absolutely. So today we're going to learn a little bit about C4A, which candidly, I'm guessing some of the audience is not familiar with, and I didn't know much about C4A for about 4 years. Michael will explain what it means in just a second. But before we get into that, Michael, we'd like to get to know the guests a little bit and have a little bit of fun when we kick off our episodes. So if I can ask a favor, if you can answer this by keeping your answer outside of the workplace preferred, but can you tell us something about yourself that would surprise us? A fun fact, hobby, something like that.
Okay, quickly. Although my career now for over 30 years has been in health policy and social policy, I actually got tired of that for a period of time about 12 years ago, 13 years ago. And I live in the Bay Area, and I think anyone who moves to the Bay Area, eventually you sort of get, you learn about and get involved in the wine industry in some way, manner, shape, or form. And I got enthralled. And so I got my professional certification in wine from sort of the British equivalent called the Wine, Spirit, and Education Trust. And I actually spent a couple of years as a wine consultant to individuals and to restaurants. And at one point I was doing the wine program at Infusion Lounge, which was this hot kind of restaurant lounge in San Francisco that the 49ers hung out at. And needless to say, I was a little older than the typical people there who were working there. And because, the night didn't start until after 10 p.m., and I like to think I was kind of doing my bit to make it an age-friendly workplace at Infusion Lounge. And I also ended up making wine with some friends of mine. We did 3 vintages, and one vintage of Pinot Noir, 2004 single vineyard Pinot, actually won a prize. So I feel like I had a brief stint as a prize-winning winemaker as well.
I was going to say, I literally just wrote down award-winning winemaker on our show today. This might be a first. I think we're around 200 episodes, Michael, and this might be a first, or a first that we're aware of. So that is great.
Happy to be groundbreaking there in that regard.
Nice. Well, so I want to get to, basically your background. So you've hit on that a little bit. Did you grow up thinking you'd be a winemaker?
Oh, no, not at all. I mean, I grew up in Seattle back in the early days before Microsoft and tech and all of that. It was a town that was really all about shipping, timber, and planes. So you have to think of a very different world back then. And fortunately, my father was in the shipping industry, and we had a chance to travel a lot. He was a lobbyist, actually. So I got to travel, and I got to kind of realize that the world was much bigger than Seattle. and that's a difficult thing for, because Seattle folks are very proud about where they live. So I decided I was going to leave at 18 and go off and go to college somewhere exotic, which turned out to be Montreal. And I did my college degree in Montreal and learned French, and because it was important, and then came back to the States for graduate school. But that was sort of the first step toward an attitude about the world, which is really that, we're going through this life and it's really about growth and development. And so since that time, well, I lived in New York and Boston and DC and lived in LA for a while. And so ended up in the Bay Area. And, so here, and now I'm here and working at C4A.
Yeah. So when you mentioned like your dad was a lobbyist, so he was a lobbyist for like what type of shipping? Like, if you mind me asking, like boats?
Yeah. No, he was actually a lobbyist for the Longshoremen's Union. So he was on that side of the shipping, and it was the West Coast Longshoremen, ILWU, and he reported to this guy named Harry Bridges, who kind of is one of the legendary labor leaders in this country, and then Jim Herman, who went, replaced Harry. So it was interesting. It was interesting growing up in that context, I have to say.
Yeah, that's really cool. So you grew up seeing someone lead on the lobbying policy side. You mentioned you went to school in Montreal. Don't have the Canadian accent that I can pick up on, at least, but you were there a short time. So you're an award-winning wine guy, and you speak French. Those seem to go hand in hand a little bit. And then
French would think so. Yes. Yeah.
So how did you've been out to New York? So was that like when you went to Montreal for school and you did your schooling and master's degree, things like that? Was that all policy focused or poli-sci?
Well, I went to a public policy program at the University of Michigan where I got my master's. And when I graduated, most of the people from my program would have gone to DC because it's really federally focused. And health policy is, traditionally a federal, mostly federal. But it was during the Reagan administration, and there really weren't any jobs for health policy people. So I ended up going to New York and working at what was then the largest private health insurer in the country, a Blues plan called Empire Blue Cross and Blue Shield.
Okay.
And ended up doing the benefit designs for managed care products early on. So PPOs, IPAs, point of service plans, the kind of thing we all live with today. And, that was interesting because it was very innovative at that time. And I got to work with actuaries on pricing, and I got to work with provider development people, putting networks together. So it was a good foundation. And then the other aspect of that, because I was a policy person, I ended up being one of two of Empire's policy people in Albany, working with their lobbyists in Albany. And we passed, and I think the most significant thing we did was we passed one of the first laws in the country that got rid of discriminatory underwriting in the health insurance market, and also forced something called community rating, where there's a flat rate across a pool. And we did that in the individual and small group market. And that, of course, later on became embedded in ACA and Obamacare. And some aspects of that are much more prevalent now than they were then. And I have to say that turned out to be fortuitous that I didn't go to DC at the time, because Mario Cuomo was governor, the good Cuomo. And he was very committed to health policy. So that created a context that allowed New York to be very innovative at that time.
Awesome. I didn't know we're kind of a pillar in some of the things that we now see in today's healthcare world, which is really neat looking back, I'm sure, in your career. So walk us through how you ultimately ended up here at C4A.
Okay, so I got hired away from Empire and went to work at a boutique consulting firm in DC. And at that point, what we were doing is getting the consulting practice was getting coverage and payment for new products and services in the healthcare health insurance market. a lot of drugs, biotech. So, Risperdal, which is a psychotic, a number of HIV drugs, a number of oncology drugs, really getting those covered and paid for by the healthcare system. And over time, that's evolved more into getting services covered. And I ended up in San Francisco doing the same thing as I'd done in DC. And then gradually kind of spun off on my own and started a consulting practice and started working with AAAs and meals programs and other social service programs, really at the intersection of healthcare and social services, and often for an older population. So that was sort of the gradual evolution over time. And it ended up where I was in the space that we all are in now, which is really that integration of social and healthcare services for folks over 60 and also individuals with disabilities. So one of my clients actually came to me and said, we have this job in Sacramento as head of our state trade association for area agencies on aging, and I had never headed a trade association. I'm not a lobbyist. And I had some qualms, I think, at the time about moving to Sacramento. So I thought all those things would ding me. But lo and behold, they, for some reason, decided to hire me. And I like to think that the reason is mainly because of that commitment on the part of the association to the integration of social and healthcare services. And they saw me, the board saw me as a facilitator of that.
That's great. So C4A, the California Association for
Area Agencies on Aging.
Yes.
It's too many words, far too many words. And it is, and so C4A is the handy doing business as acronym. And it is really the state association that represents area agencies on aging. And if you want, I'll kind of explain what an area agency on aging is.
Yeah, that would be my next. Go ahead.
Yeah, it's one of the least known, entities in the delivery system of service delivery system in this country. So not a lot of people know that in 1965, the year that Medicare and Medicaid was passed by Congress, the Older Americans Act was passed as well. Yes. And it was basically, the intent of the act was to provide the policy rationale and commitment to providing services that allowed older people who are vulnerable in one way or another to receive services that would allow them to remain independent and in their communities for as long as possible. And that's the fundamental, sort of prime directive of the Older Americans Act. And it didn't really reference income levels. So it was really, the notion was need. Either social need or economic need. And so it expanded beyond pure economic need. So they were the act was passed in 1965. 1973, it was amended to allow for area agencies on aging, which were really seen as the backbone of the delivery network for providing those services that would allow independence to be maintained or enhanced. And so area agencies on aging came to play, or came into being, starting in 1973. And this year, in 2023, three AAAs in California celebrated their 50th anniversaries. And it was San Diego, Sourcewise in Santa Clara County, and then what was the next one? It was Area Agency on Aging 4, which is actually 7 counties around Sacramento County. So there are 3 that started at that time. And then in 2024 or 2025, the Department of Aging was established. And so that became the state unit that regulated these AAAs. And so that was the beginning of the Department of Aging in California.
Wow,
and
awesome.
And what the AAAs do is they serve as an intermediary between federal dollars from the Older Americans Act and the provision of the services. And in some cases in California, the AAA will provide those services, and in other cases, they contract out with community partners, like a Meals on Wheels program, for example. So, and that varies all over the state. The degree to which a AAA, as we call them, actually provides services. And
that's awesome. I was sorry to interrupt. I was going to ask approximately how many, like, I know we mentioned there's the one that covers 7 counties. How many total area agencies on aging are there in California?
There are 33 in California, which cover all 58 counties. Okay. And 2/3 of those are based in a county. Okay. So, for example, San Francisco has a AAA, which is called the Department of Disability and Aging. And it is the one that represents San Francisco City and County. It's the same for San Diego County, and also Ventura and San Bernardino and a number of other counties, San Joaquin, and that's 2/3 of the 33. Then the other third is sort of two kinds of nonprofit entities. One is an entity that represents multiple counties, which the Sacramento one is an example. And then there is one individual nonprofit in Santa Clara County called SourceWise that is the AAA for Santa Clara County, and it's not related to the county, and it's only in Santa Clara County. So you get a range of organizational structures. And I'll say this, that recently we spent the last year, a number of us working on a committee that was put together by the Department of Aging called California 2030, which really looked at what the delivery network should look like or might look like or could possibly look like in 2030. And it just has come out with recommendations, about 59 of them. And the Department of Aging will spend the next few months kind of prioritizing among those recommendations. And we as C4A, because we are the representatives of the AAAs in California, will take an active role in participating in the discussion about how that future service delivery network will be, what it will be. So we're looking forward to that.
That's great. Thanks for the breakdown, Michael. Very helpful. You mentioned one of the services that the area agencies on aging, which we'll probably call AAA for the rest of the episode. Is that the appropriate term, AAA?
Yeah, I think AAA is easy. It's so much easier.
Yeah, awesome. Yeah. Well, I grew up with AAA was completely different, the automobile club that a lot of folks are probably familiar with.
Right.
The AAAs, you mentioned meals. Can you give some examples of other services that the AAAs throughout the state help coordinate and or deliver for residents that are 60 and above, correct? Or is it above 60 or 60 and above?
Well, 60 or above.
Okay.
And individuals with disabilities as well, as it turns out. And some of the programs are evolving. So let's go into some of the programs. So the Older Americans Act provides funding for a range of programs, and nutrition services is one of the programs. But there's a range of others, including caregiver assistance and help at home through the Family Caregiver Support Program, transportation, legal assistance, care management, information and assistance, and also the nutrition services, as I mentioned. Those are examples of some of those services where money flows from the feds. Okay. But we have something called the Older Californians Act in California as well, which most states don't have an equivalent, which also provides funding and structure for additional services, including something called the Multi-Purpose Senior Services Program, which is sort of I think of it as a more intense, more wraparound, more comprehensive services for certain individuals, and also CBAS, community-based adult services. Yeah. So it's a range of things that kind of flow out of either the Older Californians Act or the Older Americans Act. And basically the intent of all of those services is to provide a way to keep people at home for as long as possible, and out of institutions. So one of the services that's evolved over the last 10 years or so is transition services, where you really are you're helping transition people out of a hospital or out of a nursing home and back home, because that's it's kind of a very delicate time, because people have to reestablish themselves at home or in the community, and so they need a series of support services to do that.
Okay, gotcha. So the 58 counties are covered by your 33 AAAs. Not to put you on the spot, so if you don't know the exact number, it's completely fine. About how many Californians are in that category of 60 and above?
Oh, right now, I think it's it's so funny because we talk about the future more than we talk about the present.
Okay.
But I think, but don't quote me, I think it's about 7 million, something like that, 6 or 7 million.
Okay.
And what's happening is, and what people talk about, so don't necessarily quote me on that, because I may be wrong by a little bit. But what people talk about is what it's going to be in 2030. And so you'll often hear that a quarter of the population will be over 60 by, 2030.
Okay.
And that we need to prepare for that. And I think that the takeaway from that is really, we have an aging population in California. We have a service delivery system that's sort of hobbled together over the course of many decades as a function of the Older Americans Act, Older Californians Act, and that we really need to begin to look at that delivery system to really prepare for 2030. And so I know the Department of Aging is committed to do that. I know as AAAs, we're committed to doing that as well. And in many cases, we work with our community partners on that issue. How do we integrate? Now, example of something that we're doing right now is integrating with healthcare services around CalAIM. Yeah. So a number of our AAAs have become Medi-Cal providers through CalAIM, and are working with their local designated health plans in their service area to provide services to CalAIM recipients that allow them, in fact, to remain in their homes and independent for as long as possible. So that's a step in toward rationalizing the service delivery system, where you really take both social services and healthcare services into account.
That's great. And for folks, I think most folks that are listening in, Michael, are probably familiar with CalAIM, but for those of you that are listening in or watching that do not, just a friendly reminder for those that do know, it's California Advancing and Innovating Medi-Cal. That's what CalAIM stands for. And it's under kind of the Transforming Medi-Cal umbrella that DHCS, Department of Healthcare Services here in California, is pushing over these next few years and beyond. So that's great that the AAAs have seen that opportunity. And they're great. It's a perfect fit for a lot of the health plans that are filtering those dollars to older Americans or older Californians. So one of the ways, well, let me backtrack, Michael. You'd mentioned earlier in the episode that a lot of folks don't know about the AAAs, which I think is true, especially for younger folks. One of the great opportunities that I've learned about the AAAs is your upcoming annual conference. Can you talk a little bit about that?
Oh, absolutely. Our annual conference is taking place in San Jose on May 1st to 3rd, shameless plug. And it targets, it's actually, it targets people who are providing services, to the folks over 60 and individuals with disabilities. So we have, along with disability providers, are organizing this conference. We're also working with the Commission on Aging as well. And the theme of the project, the conference, is the Aging and Disability Network, the best is yet to come. And we're organizing sessions around actions, interventions, activities that allow us to be better at what we do, and whether it's integrating services, whether it's providing a particular service better. And so a lot of the kind of focus of this conference is going to be on best practices. And you fill in the blank about what those, what the best practice would be. But we want to make sure we kind of help arm people to both prepare for the future and also have some guidelines and some program examples for how you do that. So it's going to have a very practical focus, and although we will have some national policy people there as well, to talk about what's going on at the national level, and which is important, and then also some state level people as well. So we'll have the governor's advisor on aging, for example, Kim McCoy-Wade. Have Susan Damaris, who's head of the Department of Aging. We'll have Sandy Markwood, who's head of our national association, who is quite visionary. And we've invited the governor, but he's a busy man.
Yes.
And so we don't know what will happen in that regard.
Well, that's great. And even if he doesn't come, you got some folks who are big influences, and great leaders. You mentioned Kim McCoy-Wade, who was actually a past guest on the show and talked about all the different pillars of the master plan. So that's great. And I know some of those names, and I know myself or my colleagues will be there as well for that conference. Now, the conference is in San Jose this year. I know in the past, Glendale or Southern California has been spoiled a little bit by having the conference, and that's a hop, skip, and a jump from where I live. So it's easy for me to get there. Why San Jose this year?
Well, we wanted to spread the wealth a little bit because we have tended to have, at least since, this is my third year now. In the first 2 years, we had the conference in LA, and I understand before that it was in LA as well. And we thought we'd spread the wealth a little bit and have it in Northern California. So we're going to try it up here in the Bay Area, and see how it goes. And maybe what we'll end up doing is going back and forth, doing a Northern California locale and then a Southern California.
Yeah, I figured that may be the case. That you wanted to spread it out, spread the love a little bit. It makes sense. And San Jose has got a great airport that's easy to get in and out of. So, and cheap flights too. So
no, that's good. So my one disappointment about the conference is I suggested a kicker for the title, and that it would be knowing the way from San Jose. But people didn't seem to think that would necessarily work. So I don't know.
They might be onto something there, but good effort there, Michael. Well, that's great. So folks that are listening in want to attend the conference or maybe support. One thing I noticed in the past is, a lot of the exhibitors, a lot of the attendees are government related, but this is also a great opportunity for service providers or not necessarily government related folks to learn as well. Is that correct?
Yes, it is. It is targeted around service delivery, but it is, it can handle a broader audience. And I think the subject matter is such that it would interest a broader audience as well.
Definitely. So if you serve older adults in any way, check it out. Great learning for me. Again, like I mentioned, I've been in the industry for 20 years serving older adults, and I'm really grateful that I learned about C4A. So if folks do want to attend, Michael, or potentially support the conference, how do they learn about it? What's the website?
It's just it's www.c4a.info. So just c4a.info. We have a brand new website, and so it's timely. And our very first information on the website is the conference. So we are building out the website. It's in process. There won't be all the information that we'll eventually have on there yet, but please go check it out, c4a.info.
Awesome, Michael. Very good. Well, we're closing out the show now. Is there anything else we haven't touched on that you think folks should know about C4A and some of your maybe initiatives for 2024?
Yeah, I think our prime initiative in this year is there is a program that now is part of embedded in the Older Californians Act called Aging and Disability Resource Connection. And it's designed to provide comprehensive resource information to individuals that they can use to find services. and it's open and anybody. It's to people of all ages, any income, whatever. It provides options counseling. It provides warm handoffs and follow-ups, and sometimes it will do short-term service coordination for folks who need. They need a long-term plan to be developed, but they're not there yet. So it's a very comprehensive program that is rolled out, not complete. It's meant to be rolled out completely across the state, but it's still in process. And there's $10 million allocated a year by the legislature for that. We've done the math, and we realize that actually it needs more money to fully be realized as a statewide network. There's still 16 organizations across the state that haven't been able to kind of join the effort because there's no money. And so we're advocating this year, actively advocating for increase in funding for the Aging and Disability Resource Connection. And we're doing that with our independent living center colleagues because this ADRCs, as they're known, are managed by both AAAs and independent living centers. And so they're both, it's kind of a jointly managed, and it varies by county and jurisdiction who's the prime manager. But it's really important, I'll say, to have additional fundings because you can't really have expanded a statewide network that's sustainable unless you do that. And since I'm going to bring in the master plan finally, since ADRCs are considered a prime component of a no wrong door network, which is one of the goals of the master plan on aging, we really feel it's crucial that additional funding be provided to the ADRCs. We'll be working on that.
Yeah, and I'm assuming in San Jose at the conference, this will definitely be highlighted since it's your major initiative. And I did not know about the aging or the ADRCs until the conference. So great initiative. Michael, really appreciate you being on the show today. If folks want to stay up with you, are you active on social media, or should they just follow the website to stay up to speed of what you guys are doing?
Yeah, we have on Facebook, Instagram, LinkedIn, we have a C4A site. So you can find us at California Association of Area Agencies on Aging. And you might be able to just plug in C4A in the search function. That might work as well.
Sounds good. I know your colleague, when we were putting this episode together, she's definitely working with me to make sure there's visibility on what you guys are doing, and including this episode. So I definitely see the initiative there to have a good presence online. Well, Michael, really appreciate you. Folks, I've known Michael for many years, but gotten to get to know him a little bit better just more recently. So it's great to have you, Michael, and look forward to seeing you in San Jose. Thanks again for joining today.
Thank you, Gavin. It's a pleasure.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.